Hello, this is Ruth Hollingshead, trustee for Site for Wight, welcoming you to this week's Talking News.
Site for Wight Talking News for Friday the 15th of May 2020.
Alison, reading from the Isle of Wight County Press. A return to safe boating. Cowes Harbour Commission's notices after new guidelines. Cowes Harbour Commission says it did not receive the government's guidelines on boating during the current coronavirus until Wednesday night, 3 days after Prime Minister Boris Johnson's announcement. The organisation says it has been working closely with the British Ports Association and UK Harbour Masters Association to manage a coordinated and safe phased return for recreational boating. Yesterday, an Isle of Wight marina reopened, allowing many back on board to carry out safety checks and maintenance. A statement said, Cowes Harbour Commission's decisions and timeline have been governed by a statutory harbour role and responsibilities to take appropriate and considered decisions prioritising the safety of our staff, local boat owners and the local community. Its board has now agreed to encourage and facilitate a controlled return to safe, family recreational boating, allowing boat owners to access their boats for day use to and from their local mooring and for maintenance purposes. 2 notices to mariners have now been issued. Meanwhile, the Volunteer Watch will return to the Needles Lookout Station from 9 a.m. tomorrow, Saturday. Only one person will be there, with a remote buddy system in place. Boat owners will be able to contact the NCI on VHF Channel 65 for current weather and sea state, radio and AIS checks.
This is Brian reading an article from the Isle of Wight County Press. Contact tracing coronavirus app. Older phones may not have correct Bluetooth. Older phones may not have the Bluetooth capability to allow the NHSX coronavirus app to work. Although 55,000 downloads have been achieved since it launched on the Isle of Wight last week, some residents have been unable to make the app work. Dr. Geraint Lewis, NHS England's Chief Data Officer, told journalists yesterday the NHS is urgently trying to make it available to those phones which cannot support the app. Dr. Lewis said there are 3 elements to it. We had to start with some of the most common phones first, and we are working our way through the list. Secondly, if the physical phone itself is very old, it might not have the low energy Bluetooth function within it to make the app work, and there is nothing we can do about it. The third reason is the operating system might be old. The app supports systems 8 and above for Androids and iOS 11 and above. If it is the operating system that is a problem, we can advise people to update their phones. Like any high-quality app, the intention is for it to improve over time. For example, things like Facebook continue to update overnight, and it is continually learning and improving, and that is what we're proposing to do here. And that is what islanders are able to help us with. For example, they might find the way we phrase something is a bit confusing, so we can change the wording and make it a bit simpler to understand its purpose. There still remain queries over how the app works and whether the data will really be kept private. Dr. Lewis said, the way the app works, the user data is completely anonymous up until the point where you want to order a test kit, at which point you have to give us the contact details so we know where to send the test. All of the legal protections people would expect, such as GDPR, all of those things apply, as well as the same protections we have in place for any NHS data set. The NHS looks after people's very private details, and we have established ways of dealing with that. When the coronavirus pandemic is over, the app will be removed from the app stores and people asked to delete it from their phones. It may be better to think about mothballing it, said Dr. Lewis, just in case another pandemic were to come back in the future. Then we can hit the ground running because we will have all of the intellectual property available in the NHS app. Simon Bryant, Director of Public Health for the Isle of Wight, said there will be a lot of learning from it that might be helpful.
This is Chris, reading an article from the Isle of Wight County Press. Lockdown relaxation means app more important than ever, says Isle of Wight MP. The Isle of Wight coronavirus test and trace app has been downloaded 73,000 times, the government has revealed. However, it has not commented on how many of the downloads are exclusively on the Isle of Wight. In addition, some are multiple downloads to the same person. MP Bob Seeley welcomed the take-up, saying it showed strong engagement on the island. In a joint letter to Health Secretary Matt Hancock and the Health Minister, Mr. Seeley and the Isle of Wight Council leader Dave Stewart said they were compiling, with local partners, a detailed portfolio of learning from their experience of engaging the local community in using the app, as well as the wider Test and Trace programme, to inform the forthcoming national rollout of the app, all with the support of central government. The letter, written a week after the app was rolled out on the island, said uptake had been strong on the island, with the overwhelming majority of downloads from the island. Mr. Seeley said, the latest download figures show the very strong engagement and response from the island. Not all the 73,000 or so downloads will be islanders, and some islanders have downloaded more than once, but the consensus is that the island has downloaded the app in significant numbers, and our use will drive understanding of it. It's important to remember that the Trace and Test programme is not only about the app, but about the entire programme to keep us safe. By getting this Trace and Test programme early, we have kept islanders safer earlier. In addition, the island is helping the NHS with both technical but also real-world solutions to make sure the app and the Trace and Test scheme can help the rest of the UK. We need to keep downloading the app, making sure it is on, keep sending feedback on the feedback form, and by doing that, help the rest of the UK to support the NHS and care homes and to stay healthy. It was confirmed this week that around 25 people per day are being tested at the Medina College Testing Centre, having made their symptoms known through the app.
This is Howard reading an article from OnTheWight about the West Wight Hub. Throughout the period of coronavirus crisis, News on the Wight has heard heartwarming stories of people and organisations around the Isle of Wight coming together to help each other. One of those is the West Wight Hub. When it became clear the level and size of the impact of coronavirus, those at the West Wight Sports and Community Centre did an amazing job of refocusing their time and attention. News on the Wight caught up with Claire Griffin today to find out more detail. She really summed up how good things are happening in and around the west of the Wight community. We're going to come out of this even stronger than we were before. Lots of people are being helped and helping. The set of figures is really impressive and tells a clear story of how many people have been helped and quite how many are helping. 489 people have asked for help, 314 people have volunteered to help and support, 392 people have been assisted with prescriptions, 32 people are receiving hot food deliveries. On top of all this, the community around the West Wight have made 200 sets of scrubs and face masks, plus 160 wash bags have been made for local care homes. Claire told News on the Wight that she was looking for a positive outcome from the situation. From all bad things, good things come, and one of those was connected to the already strong community around the West. By way of illustration, from the outset, the West Wight Hub paired the volunteers with individuals who were requesting help. That way, even beyond the time of COVID-19, those relationships will remain strong. The volunteers aren't just the sort of people to drop those people once it's all over. We've set people up to continue supporting each other. Of course, being positive in nature, West Wight Sports Centre is keeping one eye on what will happen after this current period of lockdown. With such a strong growth of volunteers in the area, Claire says they'll be able to expand how they can help the community once things start moving to a more normal basis. Their Our Place sessions, attended by Sight for Wight, the drop-in cafe, is a good example. We'll almost certainly be able to run that more often than once a week, as it was pre-COVID-19. We've got more volunteers on the team now, and we've made contact with more vulnerable people. Can you support them? It's clear that everyone at the West Wight Hub are doing all they can to help the community. If you're able, please actively consider supporting the West Wight Sports and Community Centre fundraiser, which continues.
This is Brian reading an article from the Isle of Wight County Press. Linbottom Tip man had car full of garden waste. An island man said he disposed of a car full of garden waste at Linbottom Tip, not just a coat hanger and faulty charger as claimed by the Isle of Wight Council. The council sent a press release to all island media outlets earlier today with a photo of the two items and a reminder that people should only consider visiting the tip if it is genuinely essential. It was claimed someone had visited the tip to dispose of just the two items. However, a man has since stepped forward after recognising his items and said he had a car full of garden waste too, and was told to hand the two miscellaneous items over to a waste handler. He told the county press, "I had booked a slot for 10:30 a.m. yesterday morning and went there with my car filled to bursting point with garden refuse. I also took the broken coat hanger and the faulty charger, both of which were items that fell into the categories of what could be accepted. On arrival at the tip, the helpful man at the entrance asked what I had to dispose of and, on learning that 99% was garden waste, said he would take the other two small items to save me from having to park in two different places. I gave him the items and went straight on round to unload the garden materials, did so and left." When contacted by the county press about the claim, a council spokesperson said they would look into it and check CCTV. They said this photo was one of many examples of single, small, non-essential waste items that have been brought to the tip over the past 3 days. Others have included single computer monitors, cardboard which is collected at the curbside, and single car batteries. We would like to continue to stress that trips to the recycling centres at this time should only be made if it is not safe to store the waste on your property or is causing a risk to the environment or a risk of injury. Bringing single items or items that can be stored safely is not an appropriate use of the booking system and is a health risk to yourself, staff and other visitors using the site.
Hello, this is Steve reading a story from the OnTheWight online news site, headlined A Glimpse of a Possible Future, and this article is by Jonathan Dodd. Back in the day when I thought I had a career, I used to meet lots of people who couldn't wait to retire. They were mostly men, because in those days it was mainly men. Nobody noticed or mentioned that because that was how the world worked. I believe it has changed somewhat, although every freedom, no matter how hard won, is easily reversible unless you pay attention. As you'll have read often in these columns, the price of liberty is eternal vigilance. We're not very good at that. Part of me wonders whether, amidst all this clapping and these cries of success and valiant fighting against the invisible enemy, the hope for future won't be darker and less free than the scorned past. But enough of that. I want to write about the idea of retiring. All these men would sit there at their desks and sigh whilst looking off into the distance, obviously deep in thought. "I can't wait," they would say. "Wait for what?" I'd ask. "Until I retire," they would say, with a beautiful but sad smile on their faces. They would have a specific date in mind, and they would know how many more years and months and probably days until the blessed event. "So what are you going to do?" I would ask innocently. Their smiles would cloud over. "What do you mean, do?" they'd ask. "I'm going to retire." "Yes," I'd say, "but what are you going to do when you retire?" This wouldn't get me very far. "I'm going to retire. I won't be doing anything." At that point, unaccountably, they would become irate. So I went back to musing and chewing pencils, which made me look as if I was working, when as often as not, I wasn't. I never had much luck explaining that every minute spent thinking about the project meant 5 minutes gained in efficiency and good design. Perhaps I didn't become irate enough. Sometimes I have wondered whether I was living on the wrong planet, or the wrong timescale, or something equally unlikely, at least in the woefully limited imaginations of those arbitrarily put in positions of power over me. I wasn't comfortable with the idea of these men, who had this concept of a finishing post in their minds, but beyond that, there seemed to be nothing at all. These were often men who spent their week away from home, living in B&Bs, going out to the pub every night for an unhealthy meal, washed down with several pints of lager, whilst watching football, any football, on the big screen. On Fridays, they'd ask me what I was going to do at the weekend, and I had 100 things to be busy with. When I asked them, they'd say, "Well, I'll get up on Saturday morning, and my wife will tell me she's going shopping, then out to friends, then off to a thing with the kids, and the kids will have sleepovers and games and parties, and I'll just sit and watch football on my own. I feel like a stranger in my own home." And sometimes they would add, "Here I am, paying for it all." So what, I thought, are they going to do when they finally kick the ball through the great goalposts of retirement in the future and the referee blows her whistle? But I kept that thought to myself. I once asked someone what he was going to do when he retired, and his face lit up. "I'm going to learn to paint, and I'm going sailing, and I'm going to build a workshop in the garden and buy a lathe," and on he went with a happy smile on his face. I wondered whether he would actually do any of that, because he hadn't shown any inclination to start any of these activities while I had known him. There was one man who used to take his family all over the country every weekend so he could take photos of Victorian railway architecture. He was famous already on the railway architecture enthusiast circuit, taking his slides and giving presentations all over the country. He had the right idea, I thought, because he already had something he loved. I also wanted to know what his family thought of all those weekends tramping up and down railway lines so he could get the best shot. They were probably dreading the thought of him retiring. We're all getting a glimpse of that future right now with the lockdown. Because I have no friends, it has made hardly any difference to me and my lifestyle. But I don't know about anyone else. Are they getting on with their families? Rediscovering the love and joy of spending time with nearest and dearest? Are they all sitting round the living room table playing board games and treasuring this unexpected free time? All the celebs are there on social media, proving day after day that they are talented and confident people worth following, even though they haven't got the usual grooming resources and photographers and fashion influencers to fall back on. wryly mocking themselves and hoping they'll still be loved and paid by their adoring fans when it's all over. And some of them will, I'm sure. I'm really missing the cinema. It fulfills much the same function in my life that church does for many people, without the trappings. The only real way to see films is in a large, darkened auditorium with other people who have chosen to watch this film too. Films need the darkness and the bigness and the intensity and the presence of others and the lack of interruption, apart from the insane consumption of huge amounts of ridiculously noisy snacks in the worst designed packaging ever. I know that in the early days of cinema, the industry was saved by popcorn manufacturers, or maybe it was the other way round. But there's no need nowadays to continue all that gobbling and crackling of unrecyclable wrappings. But at least there are no phone calls or people coming into the room asking what you're watching, or pauses for comfort breaks during the important dramatic moments that happen at home. So my lockdown will only end properly when I can get back to the cinema. The end of lockdown will be an important moment for all of us. It won't be a milestone event, beyond which there will be nothing, like my ex-colleagues used to imagine their retirement. It'll be a continuation of life, after this pause, during which we have had the opportunity to ponder how we want our lives to be in that future. What are we going to have learned about ourselves, and what's important in our lives? What do we want to keep doing, and what do we want to not have to do again? How are we going to spend our time once we have the freedom to choose our activities again? I've always thought of life as a journey where every footstep is unique and a choice. Do I step this way or that way? Every moment we are making these decisions, there's always a choice. We can tell ourselves we don't have choices and we can keep treading our way down the road we are told to follow. Or we can decide we're going to follow a distant signpost we've erected up there ahead, maybe labelled retirement, without looking beyond it, or around us now, in case there's something else we could choose. Or we can close our eyes and put our heads down and follow our feet as they randomly move us along without looking at anything else around us. These are all choices. I like the idea of keeping our heads up and our eyes open, looking at the scenery around us as we travel, enjoying every moment, and following as much as we can the path we have chosen, wherever it may lead. At the same time, we can notice what's happening around us, where there might be opportunities to do something different, or the same things better, or there may be opportunities we could spot in the distance that would help or add to our lives. Putting milestones on our roads helps us to move in the direction we have chosen, but they're just milestones. This road will continue after we reach those milestones, and there may be better roads that we won't notice if we're not looking. Are we okay with that? We need our eyes open and our minds busy, thinking about the present and the future, trying to make sense of it all, and trying to go towards the best outcomes. It can be hard work sometimes, but hard work is just hard work. And every bit of hard work undertaken with your good intention and effort will be rewarded in time. Obviously, never in a way you imagined, but usually in a surprising way. And I don't know about you, but I love surprises. Have a great life. Be safe. Work hard at the things that matter to you. Be surprised as often as possible. Have fun. In the absence of evidence to the contrary, live this life as if it's the only one you'll get. And don't eat noisy things in the cinema. Thank you and bless you all.
This is Lisa reading from the Isle of Wight County Press. 20 feet long, 3 weeks work. Northwood Primary's tapestry of the coronavirus memories. A 20-foot banner, which took 3 weeks to complete, will now go on show at Northwood Primary School. The work of team member Jane Green, it depicts nurses and doctors, retail staff and post people, and gives pride of place to the NHS fundraising hero, Colonel, former Captain Tom Moore. The school's therapy dog Betty also features. Northwood Primary has been open throughout the coronavirus, providing care and education for children of key workers on the island. Now working towards a potential staggered reopening, acting head Sian Munford said, "We always knew that Jane was phenomenally talented artistically, but this has blown us all away. This crisis has really shone a spotlight on different threads that weave our society, some of which don't get the appreciation that they should. Jane has recognised this in her work, and we're so proud.
This article is from OnTheWight and is read by Terry. Don't fall for contact tracing app scam text message. A text message encouraging app users to click on a link to a scam website has been circulating. With the Isle of Wight actively trialling the app, we need to help keep each other alert to this. A number of scams have been reported since the start of the coronavirus crisis, the latest of which relates to the contact tracing app, and as we say, we need to help keep each other alert to this. Mobile phone users have reported receiving a text message that states, "Someone who came into contact with you tested positive or has shown symptoms for COVID-19 and recommends you self-isolate or get tested." The text message includes a link to a scam website that asks for personal details. Scammers may use this information to gain access to bank accounts and commit other forms of identity fraud. It's a scam. Do not click on this link if you receive a message like this. If you are using the contact tracing app and have come into contact with someone who has reported symptoms, you will be notified through an alert on the app. You will not ever receive a text message, so ignore any you receive that may claim to be related to the app, or those offering cash payments for the COVID-19 relief or so-called fines for leaving your home. These are just some of the scams that have been doing the rounds. That's from Heart, gigantic surge in activity targeting UK customers. The Chartered Trading Standards Institute, the CTSI lead officer, Catherine Hart, said, "We have witnessed a surge in COVID-19 related scams since lockdown began. This evidence is yet another example of scammers modifying their campaigns as the situation develops. I am especially concerned that scams themed around the contact tracing app are already appearing, even though the official NHS app has only been released in a limited testing phase on the Isle of Wight. These texts are a way to steal personal data and may put the bank accounts of recipients at risk. If anyone receives texts or any other kinds of messages like this, they should not click on any accompanying links and report them to Action Fraud. During the Isle of Wight phase, changes will be made to the app to improve how it works before rolling out across the country.
This is Brian reading an article from the Isle of Wight County Press submitted by Sarah Burdett of the Isle of Wight Society. We have been remembering VE Day and all it meant to those who survived the war. Not everyone had happy memories. Every year we visit memorials and read the names inscribed. Some servicemen made it home but died of their wounds. Their headstones are cleaned regularly by the War Graves Commission, standing out creamy white in graveyards. But we must remember many other people. There were those in reserved occupations and those too young or too old to fight and who served their communities in many ways. There are war graves for those who died while serving in the Home Guard and ARP, the front line at home. 5 lost their lives in East Cowes. Their headstones are in Kingston Cemetery. Those serving in the fire service were also in great danger. In 1942, during the May the 4th Blitz on Cowes and East Cowes, fire crews from all over the island were called in to help local forces. 2 firemen from Ryde, Colin Weeks and Bert Dewey, died while on duty in East Cowes. Gasometers in East Cowes were surrounded by flaming buildings and piles of coke were giving off toxic fumes. It was decided that the fires should be fought at whatever cost to prevent an explosion. The firemen succeeded, and some received commendations for their heroic action. Shanklin Fire Station suffered a disaster when it was hit in January 1943. Many of the 23 people killed that day were firemen. Set beside the War Memorial at Shanklin is a memorial to all those firemen. 3 Trinity housekeepers at St Catherine's were killed in June 1943 when German aircraft attacked the lighthouse. Buried at Knighton, their memorial plaque is displayed at the lighthouse. The Women's Voluntary Service helped everywhere. In East Cowes, Mrs. Han, WVS, died serving tea to the firemen during raids in May 1942. After the war, a memorial was set in East Cowes churchyard naming her and all the local civil defence men who died. It has an ARP helmet and a shaded torch carved in the stone. Many ordinary people of the towns who died are remembered annually at services in Cowes and East Cowes. Their names were read out again at the graveside even this year, and flowers laid.
This is Sue reading the letter sent by the RNIB through the Isle of Wight Council to all visually impaired people on the Isle of Wight. Dear Sir or Madam, COVID-19 advice and information for blind or partially sighted people. The Royal National Institute of Blind People, RNIB, has asked us to share the attached document providing information and advice about organisations who can provide support to people who are blind or partially sighted during the period of disruption caused by coronavirus. In addition to this national information, we would like to take this opportunity to remind you that the Isle of Wight Council provide a sensory service which supports island residents who have sight or hearing loss and is delivered by Action on Hearing Loss. This service is continuing to support people through telephone contact, with its team working remotely from home. If you would like to contact the team, please email them on iow@hearingloss.org.uk or telephone on 01983 529 533. The Isle of Wight Council have also set up a helpline to offer support to vulnerable island residents who are affected by coronavirus self-isolation measures. The telephone number is 01983 823 600, which is available 7 days a week, 9 a.m. to 5 p.m. Yours sincerely, Kathy Glover, Commissioning Officer. Advice for blind and partially sighted people during coronavirus, COVID-19, COVID-19. We're sorry if this letter is difficult for you to read. We want you to know that there are organisations which can help you during this very difficult time and want you to get in touch as soon as possible. This letter is in large print. If you would prefer a different format, please let us know. We appreciate that the coronavirus pandemic may be causing you many additional challenges, so we've brought together some key contact numbers and advice on how to get support in your local community below. You'll also find answers to the questions we're being asked the most, but please don't hesitate to call if you need help. RNIB's helpline 0303 123 9999 has extended its opening hours. It is now open on weekdays from 8 a.m. to 8 p.m. and on Saturdays from 9 a.m. to 5 p.m. In addition to the usual help and advice on living with sight loss, our advisors can connect you to local support and assist you in signing up to telephone and online groups that may offer you a source of comfort in these times. Through the same number, you can also access pre-recorded information on the coronavirus and the government's response. Also, Guide Dogs COVID-19 information line 0800 781 1444 is open on weekdays from 9 a.m. to 5 p.m. It supplies answers and information for adults and families of children with sight loss about living actively, independently and keeping well during the coronavirus outbreak. Whether you're asking for yourself, a member of your family or your child, both organisations offer online support and telephone services and can help you access services from other providers. Finding local support. Communities across the UK have mobilised so they can help people who need additional support locally. We have put together a list of organisations across the UK who can help you. This information is available through both the RNIB helpline and the Guide Dogs information line. Local authorities can also provide essential supplies. You can get in touch with them directly for more information or call us. Eye health. During this time, you may be concerned about attending eye clinic appointments. Hospitals have rearranged their clinics to reduce the risk and minimise contact with other patients and staff. You can always call the hospital to seek advice. If you have a sudden change in your vision or new symptoms, contact your optician or eye doctor immediately. It is important you seek help. Please don't ignore symptoms. Shopping for food and essentials. Supermarkets are changing their delivery service to prioritise the needs of clinically vulnerable people, but we know how many people are still struggling. The situation is changing daily and we are taking action to raise your concerns directly with the supermarkets. NHS volunteers across the UK are collecting essential supplies for people unable to leave the house. If you are worried, we can help. Getting out and about. Although social distancing can be difficult, it's really important for your mental and physical health that you still go outside and get exercise. So if you don't live with someone who is able to guide you, think about using your cane to alert people to your sight loss when you go out. Alternatively, you can let others know of your proximity verbally and that you are unaware of exactly where they are. Keeping connected. During this time, it's especially important you stay connected with the outside world, whether it's having Skype calls with family and friends, joining a talk and support group through the RNIB helpline, or signing up to a Keeping in Touch call with Guide Dogs. There are many sight loss forums available and most are open to your family and friends too. Having regular contact with people will help you to stay feeling positive. If you also want to stay connected with the latest developments and information on coronavirus and sight loss, listen to RNIB Connect Radio, the UK's radio station for blind and partially sighted people. It's available on Freeview 730 and online www.rnibconnectradio.org.uk. Contact us. RNIB's helpline 0303 123 9999 is open from 8 a.m. to 8 p.m. on weekdays and on Saturdays from 9 a.m. to 5 p.m. Guide Dogs COVID-19 information line 0800 781 1444 is open on weekdays from 9 a.m. to 5 p.m. We know this is a difficult time and many people are feeling worried and isolated. These are just a few of the ways we can help you during this time. There is lots more advice for blind and partially sighted people available. So please get in touch if we can help. Stay safe.
This is Lisa on behalf of Sight for Wight. Here at Sight for Wight, we have found 3 ways to help raise vital funds and awareness of our charity. These are Clear Out for Charity, Sight for Wight survey and Dress for Less logo competition. Clear Out for Charity. Our clothes agency based in Newport is seeking donations of smart casual and formal wear clothes and accessories for sale online to raise fund whilst the shop has been forced to close. We can come and collect them safely from you, or you can drop them in sealed bags into Millbrook House on a Friday between noon and 4 p.m. Sight for Wight survey. We have launched our new survey and are asking anyone who attends the eye clinic at St Mary's Hospital to take just 5 minutes to complete it and help shape the future of services that we offer. We want to serve our members as best we can, and we need your real input and ideas to do this. Thirdly, Dress for Less logo competition. Finally, we are asking Isle of Wight designers and students to design our new logo for our clothes agency Dress for Less. The competition is being judged after the closing date of the 15th of July by Isle of Wight firm Rapa Nui. Rapa Nui have gained international recognition for their sustainable clothing. We are very excited about seeing the entries and picking the logo which best depicts our agency but incorporates what we are doing here at Sight for Wight. All information can be found at www.sightforwight.org.uk, www.sightforwight.org.uk.
This article is from the Sight for Wight newsletter and is read by Terry. Touch Tours, written by Ruth Hollingshead and Flora, her guide dog, who attended. Joe Bresloff is a freelance artist educator who is very passionate about making arts and heritage venues accessible for everyone. She organises touch tours which are friendly and informal opportunities for visually impaired people to have a hands-on experience wherever possible of some of the arts and heritage exhibitions and collections in both Southampton and Portsmouth. On the 6th of February, my guide dog Flora and I set off to take part in the touch tour at God's House Tower in Southampton. God's House Tower is part of the medieval wall that used to surround the city. It has been used as a jail, a mortuary, a mill and a warehouse, but is now a cutting-edge arts and heritage venue. We began with a brief history of the tower and then a hands-on tour. A group of us were guided round the 3 floors of the building and given the opportunity to touch and feel both the historical architecture and the modern art installations, one of which was a huge tactile map of the old city. I particularly liked a large sculpture that was covered in graffiti from medieval prisoners who had been held in the tower. This included names, tallies, dates, and even a few rude cartoons. These had been laser cut into the surface of the piece so that you could trace them with your fingers. Flora behaved beautifully, and we really enjoyed not only the tour and the tea room, but also the chance to meet other visually impaired visitors from across the Hampshire area. Joe will be holding more touch tours later this year, and we will keep you updated with the details.
This is Lisa, reading from the Sight for Wight newsletter. Southern Vectors visit. On Wednesday the 11th of March, we welcomed Richard Tilsley, the General Manager of Southern Vectors, along to our weekly coffee morning. He updated members on the services offered by Southern Vectors and answered questions that they had. The Southern Vectors website is equipped with Recite Me technology, which will read out the text on the page to aid navigation of their website. They are also happy to provide large format printed timetables on request. Many of their buses are now fitted with next stop announcement technology, which can help you keep track of where you are on your journey. They have added, during this COVID-19 pandemic, buses are running to a restricted emergency timetable. Please always check before you travel.
Sight for Wight would like to thank you for listening to this week's edition of the Talking News. We would also like to thank our volunteers for reading, and a particular thank you to the Isle of Wight County Press and OnTheWight. A special thank you must go to Vectis Radio, who has helped us get vital information to our members. Stay safe.